Welcome. My name is Dr. Wayne Wightman. I've been with the Holtorf Medical Group and Dr. Holtorf for the last 20 years. I want to go through things that I've learned and experienced. So a very common problem that I see with a lot of patients is a problem called hypercoagulation, which is also referred to as post-exertional fatigue. It's where patients overexert themselves or push themselves or do more things than usual and crash. They also tend to bruise, although us guys don't bruise quite as easily as females. Many females tell me they bruise much easier than their friends. So the problem is highly related to having a weakened immune system and various infections. Candida is one of the worst. If somebody has candida into the bloodstream, that's one of the biggest things that cause this problem called hypercoagulation. So the blood is carrying oxygen and nutrients and hormones to the cells. When the blood vessel becomes tiny at the capillary level, these things diffuse across into the cell. And that's natural and normal all through the body. That process normally takes 2 seconds. We could measure that, and that's what a healthy person does. When you have these various infections, the infections make things that we can measure in the blood. It's officially called hypercoagulation. The infections make these products, these molecules, to hide out in to make it harder to get rid of. But what happens to the patient is that it takes longer for the oxygen and the nutrients and the hormones to get from the blood into the cells. So instead of 2 seconds, it could be as horrible as 5 minutes. Very few are that bad, but it's definitely longer than normal. So this is part of the theory where it takes things longer to get across of fatigue, tiredness, brain fog, contracted tights or achiness in the muscles. The patient crashes when they push themselves. They tend to bruise more easily, and the blood is thicker and darker. Some patients say they went to get a blood draw and they couldn't even get the blood out. It was so thick. That absolutely is hypercoagulation, and the patient in all probability has increased risk of blood clots. To treat this problem, we need to boost the immune system up, and I like things like immune stim, some of the peptides, vitamin D, and probiotics. That's the first key step. I'm going to later talk about some of my favorite supplements, including immune stim and what's in it. But patients need immune stim, vitamin D, probiotics, and a couple of the peptides I like thymosin alpha, thymosin beta. And then I need to give a Pacman enzyme. I like Fibernex. We've used 3 different products over the years. Fibernex has been the best of the 3 products we've ever had. It basically has Pacman enzymes that go around and gobble up this sludgy stuff in the blood to improve the perfusion of the oxygen, nutrients, hormones, to get to the cells easier, quicker, to improve quality of life with less crashing and less bruising. The Fibernex enzymes are things like nattokinase, lumbrokinase, seropeptidase, bromelain. And by doing these things, it helps this issue. Some patients, though, are so bad that their problem is so significant that we need to add in a second thing called heparin, which is an injectable. Heparin would be as a very low dose therapy, basically a half a cc once a day. Heparin has a very unique ability to clean up this gunky, sludgy stuff and decrease the risk of blood clots. The dose is a tiny dose. It's a subclinical dose, 5,000 units a day. I used to use it more aggressively, but going slow and longer term has been much more effective. So that's basically this whole problem of hypercoagulation, crashing when you push yourself. People say, well, what do you mean by crashing? Some people say, oh, I took grandkids to Disneyland and I crashed and I spent 2 days in bed. I maybe cleaned the whole house, which I usually don't do. Again, I spent a day or 2 in bed. Or maybe I went out and normally I'd maybe walk a couple blocks. I tried to walk 6 or 8 blocks. I went home and I had to sleep for 4 hours. That's what crashing is. And of course, increased bruising is obvious. So that's this whole problem of hypercoagulation. Many doctors do not understand this problem. I've seen that over and over. I've sent patients to them to get evaluated, and they say, oh, I don't think it's a problem, where it is a very big problem. And many of my patients have this issue. Many doctors learned about increased risk of blood clots with COVID, but simply that's because it's another infection. So that's the kind of a summary of how I address the whole problem of hypercoagulation. Thank you.